Okay, I am going to be doing a postpartum assessment, and this is my patient, and let's get right to it. So first thing you would do when you walk in, you use hand sanitizer or wash your hands. You'd introduce yourself. I'm a student nurse. I'm Steven, and I'm going to be doing a postpartum assessment on you, just making sure everything looks good and there's no problems. So first thing, do you have any pain anywhere?
No.
No, so nothing to direct your immediate attention to, so that's okay, that's good. You move on to vitals. You can either hook them up to vital machines, the pulse ox, get their oxygen as well as pulse there, their blood pressure, do the cuff, or you can also do it with this if you have the equipment, the cuff that goes with it. You just put it there and you find the blood pressure, the heart rate. I can measure her heart rate. I would have to put this to her heart and count for 30 seconds and then just multiply that by 2. But yeah, and then I can take her temperature here. Anything above 100.4 would indicate infection. So if everything's within normal limits, we can move on. You would also check blood pressure, make sure that's within normal limits, because if it's high, it could indicate preeclampsia or eclampsia, and that's definitely something you should watch out for. So then once you're here, you could finish with the stethoscope and listen to her lung sounds. Just make sure they're clear bilaterally. I'm just gonna go in here and just breathe normally for me. Okay, and once you're here, you can check the GI. Just make sure the bowels are active, and they should have active bowels. You should hear some motion going on in there. And then we're gonna move on to the CVA tenderness test. And if I can have you stand up, what this is, you're tapping on the lower back, the lower portion of the spine, and just asking, do you feel any pain? No? So no pain there, and that's a good sign. Let's see. So that would be a negative for that CVA tenderness. So once you're finished with your visual assessment and all that, we can move on to the bubble T. Well, this is still kind of part of visual assessment, but anyways, they call this bubble he. Sorry. And the first thing to check would be your first B would be breasts, and they'd want to be soft, full. You'd want to check for any like red spots, any cracks, anything that might hurt the patient. Is there any pain in your breasts or nipples? Okay, and so they should be soft, should be full if she's breastfeeding. So now that you're kind of this topic, you kind of just ask questions about her breastfeeding, such as, is the baby's jaw like moving up and down? Like, can you see the baby's actually swallowing? Is it latching on? Any pain, if the baby's peeing and pooping, how much a day it is. And then, so the next letter would be U, that would be uterus. And so you'd want to kind of just palpate the uterus. It should be at the belly button right after delivery. It should be firm. If it's boggy, that's dangerous. You gotta pay attention to that. Could indicate a postpartum hemorrhage. So if it is in the case boggy, you'd want to massage that with the hand underneath, kind of like just so it doesn't like pop out. It is known to do that if you don't have a hand down there to support it. So once you're here, she should have her legs in stirrups, and you can kind of check lochia, kind of just see down there, make sure everything's okay. The color, the consistency, it should be clear. It shouldn't be smelling foul like infection. Yeah. And then the two other B's coming up would be bowel and bladder, and you can kind of just ask the patient, are you going to the restroom? Yes, like, and then how frequent, get all those details, the consistency, um, like the color of each of them, and especially if they had an epidural, or yeah, if they have epidural, there'll be hypotension, but really all women after they have babies are gonna have a lot of fluids. They're gonna be pumped with IVs, and so you're gonna want to make sure that they're getting those fluids out. So you can place like a hat in the restroom. Make sure you can like gauge how much they're peeing per day. But yeah, so those are the two B's. Bubble. And then the E. So then where is the L? Okay, so the L will be lochia. I got it. It's lochia. Bubble, L, lochia. Lochia is, so that's kind of what we looked at earlier with the uterus. Just making sure the consistency is clear, doesn't smell, no clots in there. If there's clots in there, that is abnormal. But if there are clots, you do want to get all of those out because, again, that could mean a postpartum hemorrhage or indicate that. But yeah, like the color, or if it's dark red, that is also normal. If it's dark red in the lochia. So here, once you're kind of looking all around here, have her roll over, and look for any bleeding under her. If there's any bleeding, that could, indicate like something going on that you don't necessarily see right on the surface. And then the E to finish it off would be episiotomy, and that's just looking for any tearing, any surgical, like stitching up that they had to do. And we can go off the Rita technique with this. That's redness, edema, edemosis, I think, discharge, and a approximity. So that's just like making sure it lines up nicely. Okay. And then the H, so that's bubble heat. The H would be Hohenstein, and that's looking for DVT. And so that's kind of just feeling around here and making sure there's no like tenderness, no pain. You'll ask them like, do you feel any pain here when I do this? No tenderness, no warmth, so that's good. No deep vein thrombosis there. And once you're here, you might as well look for edema as well. And then you can look for the clonus sign, and that's do this. Okay, just let it go loose for me, loosey goosey there, and so that should be smooth just like that. It shouldn't like be choppy. And then you can look at the reflexes as well. This isn't your bad knee. So if I had that thing, you should hit them, and the reflexes should be able to kick up. And so if it's a normal reflex, I would just rate that like a 2+ reflexes. And then so the last thing to wrap everything up would be the E, would be emotional needs and wants, and that's kind of just assessing them, making sure they're where they need to be as far as caring and in the right, like holding or taking hold, taking in stage. Like they should, if they're in the taking hold stage, they should be able to like start looking at their children and planning and just more engaged and not thinking so much about themselves and their recovery, but also be assessing their hormones, like, and just have, well, not just keeping that in mind, keeping their hormones in mind with like postpartum depression and postpartum psychosis, and knowing the difference between postpartum depression and just the baby blues, which is just not that okay. Baby blues are normal because all the high hormones. But anyways, so yeah, so that would round up, finish the bubble heat. But you can also ask other assessment questions, such as like, are you sweating? Because like I said, these patients will be filled with quite a bit of IV fluids usually. And so, are you sweating at all? It's normal if you are. Yeah, okay, yeah, you should be sweating. That's fine. That's just a way of your body getting out all those fluids. Night sweats are okay. Usually they're not, but this should be of no concern. It's fine. Look for any skin changes at this point. Some women have a mask of pregnancy, which is like it's melasma, melasma, and it's just kind of like brown patches on the face. Um, Linea negra is a line that goes like through the belly button down. Um, or like stretch marks. You know what stretch marks are. That it's just striations on the skin and these kind of like little creases. It looks like. And just kind of tell them about overall nutrition, like 300 to 500 extra calories per day, because they are nursing, or if they are nursing, at least stay hydrated and don't pick up anything heavier than their baby. But other than that, exercise is fine. And so yeah, so that should be it for the postpartum assessment.